Chairman Moran, Ranking Member Blumenthal, and members of the committee, thank you for the opportunity to discuss our work related to medication management at VA. My testimony today covers various related GAO report findings and recommendations. Effective medication management is essential to ensure veterans receive safe and comprehensive treatment. This is particularly important for veterans experiencing mental health conditions, which have been a persistent and growing issue. Many veterans also live with chronic pain, often because of injuries from their military service. Veterans may receive medications such as antidepressants or mood stabilizers, as well as opioids for pain management. Some veterans have multiple chronic and mental health conditions, which may necessitate the use of numerous medications, increasing the risk of polypharmacy. If managed improperly, polypharmacy can lead to adverse health outcomes or even overdose or death. As such, it is critical that VA ensure it is offering effective treatment, including medication, as well as non-pharmacological options such as therapy, to reduce the risk of negative outcomes. In 2019, we examined VA providers' treatment plan decisions for veterans with mental health conditions. We found veterans received a range of treatments, including talk therapy, one or more psychiatric medications, such as anti-anxiety or antidepressants, or a combination of the two. At that time, VA did not have guidance on or monitor providers' documentation of required treatment options in the plans, so we made two recommendations to address these issues. Since then, VA agreed with and took action to implement the recommendations. Specifically, VA providers are now required to record mental health treatment plans as separate, easily identifiable documents in medical records. The plans are to clearly show what treatment is being provided, the different treatments that were considered, and whether any changes may need to be further considered going forward. VA also developed an approach for monitoring the consideration of different evidence-based treatments, including both the prescribing of medications and therapy options. With this approach, VA is in a better position to ensure providers are considering all available options and providing the most appropriate treatment to each veterans. Importantly, with this information, VA is also in a position to evaluate the prevalence and appropriateness of polypharmacy and minimize the risks that it can bring, including overdose or death. Additionally, we've examined issues related to VA's implementation of its opioid safety initiative. At the time of our report, VA had reduced opioid prescribing rates, but we found VA did not consistently follow some risk mitigation strategies, such as conducting annual urine drug screening or requiring informed consent for long-term prescribing. We made recommendations to address these issues, and VA has implemented them. For example, VA created a planning tool for primary care providers related to reviewing and documenting each of the risk mitigation strategies in veterans' medical records. With this tool, VA can better ensure providers are following the strategies. In light of the very serious risks that opioids pose, including addiction and overdose, it is critical that VA ensure it is maintaining careful oversight of prescribing so that it is done in a safe and effective manner. Lastly, the availability of mental health services is especially important for service members transitioning out of the military, as this is a particularly vulnerable time. The transition period can bring stressors related to housing, employment, and family reintegration, and these veterans are susceptible to mental health conditions. In our 2024 report examining mental health services for transitioning service members, we found VA and DoD identified a number of helpful touchpoints, such as pre-separation counseling, but the two departments have not assessed the effectiveness of their collective efforts, and we recommended they do so. VA has also agreed with this recommendation and stated that it will coordinate to establish a plan of action to implement it, including identifying any gaps in services or duplicative efforts. It is important for VA to take action to address our recommendation, and we will carefully monitor the steps that VA takes going forward. Addressing our recommendation will help to ensure the departments are most effectively offering mental health services to veterans as they readjust to civilian life. This concludes my prepared statement. I'd be happy to answer any questions that you may have. Thank you.